You want to go on your page and then see? Yeah, can you hear me now?
Yep.
Perfect. Okay. Is that better, guys?
Absolutely.
Let me know in the comments. Yay. Okay, perfect. All right. So again, I'm Dr. Marquis Reynolds, owner of It's Private Practice Physical Therapy in Harlem, specializing in pelvic floor physical therapy. I treat men and women here, and we recently did pelvic floor play, which is an event we're going to have every few weeks, and we're having another one for couples coming up, so you can find that in the link in our bio. And we had people ask questions on little note cards anonymously, and so I'm going to answer a few of those today. So we can get started, actually, since I see a few people are here. So the first question, let's see. Yeah, okay, so my pelvic floor hurts sometimes while I'm having sex. Is that normal? And what can I do to ease it? Also, orgasms, it takes me a while to get there. How can I help my partner? Okay, I think some of these are pretty similar. And there's another one that says, sometimes I feel pain depending on the condom. Tell me why. Also, guys, if you have questions, put them in the comments. If they're relevant, I'll answer them today. And then if they're not, then we'll answer them next week. Just the Tip Tuesdays. And this one says that I heard that if you eat a lot of pineapples or apples, it can make you taste sweet during intercourse. Is that true? Okay. So I guess we'll just talk at first about like the two most common sexual dysfunctions. So they're big words. It's vaginismus and dyspeunia. So vaginismus is going to be spasming of the muscles around the vagina. So it's your pelvic floor. Everybody has a pelvis. Everybody has a pelvic floor. It looks a little different for men and women. But these are the muscles of the vagina. I'm pretty sure some of you didn't know that there was muscles in the vagina. Vaginismus is going to be spasming of all these muscles here or on the outside, and that can actually come when you haven't been penetrated before. You can be walking down the street and just kind of feel like pain, or you could have attempted to have sex and it feels like you're hitting a wall, like the partner can't get in, or it can happen, vaginismus I'm saying, can happen if you've been penetrated before. So usually what happens, so usually what happens is it creates like a loop. So you've tried to have sex and the partner had a hard time, gave you a little bit of pain, and now in your mind it's like, okay, sex is painful. So every time you try to have sex, you're amping yourself up and you clench up and those muscles, they tighten up. So it just kind of creates a cycle. So you always feel like pain is going to be sex is going to be painful. I don't want to do it. So that kind of plays into vaginismus. The other one, which I think is kind of addressing this question a little bit more, because you said that while you're having sex, you're having pain, is dyspeunia. So that's the other big word. And that one's just pain that's really caused by sex. So it can be constant pain while you're having sex, or it can be pain that's kind of afterwards. And it can also be deep or superficial. So again, if you look at the pelvic floor, these are going to be the superficial muscles. There's 3 layers. You can't really see the second layer, but this is the first layer here. Kind of encompasses this whole area, also goes down to the anus. And then if you flip on the inside, that's going to be the deep muscles. So these are the muscles that are going to hurt when you're having deep dyspeunia. And then these are the muscles that are going to be hurting when you have superficial dyspeunia. So I guess you can just talk a little bit about superficial, because the person didn't really say like where they're having the pain. But superficial obviously is on the outside, and it's going to be early on in sex. So as you can imagine, like the first time you put it in, just when you're starting to have penetration, that person is having a little bit of discomfort. I know that it's very common to have a lot of patients that do suffer from that. And it can definitely be helped by lubrication, but it can also be caused by just the muscles being too tight. It can feel like, I'm trying to see what else I can tell you, because it doesn't always feel like pain. Sometimes it feels like itching, sometimes it feels like burning. It usually like send you to the doctor, like, okay, what happened this time? Because I don't really, understand why it hurts when I'm starting to have sex. Did I get something? But it can all kind of play into that dyspareunia. The deep penetration or deep thrusting will cause dyspareunia too, because it's poking the bear. It's if these muscles are tight, or if they have trigger points, and then you go and say like this with a penis, you're going to be poking the bear, and they're not going to like it very much. So superficial is caused by lack of lubrication. It can be irritants, and when I say irritants, I mean soap, ladies. We need to be using soaps that are especially made for our vaginas, and we also need to be using nothing with like floral scents, and your vagina should smell like a vagina. It should not smell like a rose petal or a sunset and Bahama breeze and all that stuff. It shouldn't smell like that. It can also be from different lubes that you use. So again, we talked about this in pelvic floor play, what kind of lubricants you should be using for different activities. Again, my favorite lubricant is coconut oil, only for oral sex. Please do not use it for penetration because it does mess with condoms and the effectiveness of condoms. What else can I say? Deep penetration and the deep dyspareunia. So that's the pain with sex when it's deeper. That's going to be linked to like endo. It can also be linked to like the trigger points. So you're more likely going to have trigger points here than you are going to have trigger points superficially, though it can happen in both. It's just more common because these muscles are a little bit more flat and they're more responsible and have a heavier like job and load because they're holding up your uterus, your bladder, and your rectum. What else can I say? Oh, so the question also said about orgasm. So I find typically that dyspareunia and anorgasm, so anorgasm is what it's called when you can't have an orgasm and you want one. So dyspareunia is usually linked to that because of the emotional connection with orgasms. You kind of just turn it off in your mind. It's like a mental and emotional connection to that loop, and you turn it off and you're unable to orgasm. So especially when you're having pain with sex, you really aren't in the game. So what I suggest is self-exploration and masturbation and trying different lubricants. Again, if you guys don't know what kind of lubricants to use, please put them in the comments. I'll make a post about it. But definitely try different lubes. Women out there who are listening, we are not all mac and cheese. We don't sound like mac and cheese. Sometimes it's not, we lack lubrication. It could be how much water you're drinking. It could be just like irritants again, just the soaps that you're using. It could be the pads that you're using and tampons that you're using. So I definitely say explore that and set the mood for yourself. So you want to light some candles, drink some wine, and, play some music, turn the lights down, and get in there and really find out what you like first, because that will help you help your partner. You can't really tell them what to do or help them if you don't know yourself. So I'm definitely an advocate for self-exploration and masturbation. And then I think that you should also just resolve like any kind of fear that you have around orgasming. So I know in our class, in the pelvic floor play, we spoke about squirting. And a lot of women said that like they hold back when they're getting ready to orgasm because they're scared that they're gonna squirt. They don't want to make a mess. They don't want to offend their partner. But I think that if you're having sex with someone, you should definitely be comfortable enough to tell them, this is what happens, or this is what you should expect. And once you lay the ground rules, anything is fair game, so it shouldn't be off the table. And some people are into that. Let's see, what else we can talk about? Oh, pineapples. Yes. There's been studies that have been done. Pineapples definitely make you taste a little sweeter. I'm not sure about apples, but this goes for men and women. So there have been studies on men too, with everything from like hot sauce to pineapples in men, and it does make your sperm taste different, and it also makes women taste different as well. Let's see. Is there any other like questions? I'm seeing people listening, but I'm not seeing any questions. No? Is this too much information? Does anybody need me to go over anything? No? Okay. So I guess I can just talk to you guys a little bit more about like pelvic floor PT and what I would do with women who have this, because I do treat women who have vaginismus, and I do treat women who have dyspeunia. Okay, Kelly, I see you thinking of questions. So essentially, when you come in to see me, I would be working with you one-on-one, and we would kind of just go over a full exam. So I'm going to do a full exam for you, and we'll map out everything. We'll map out everything that's going on with you. So I'll be able to take a look at those muscles instead of just giving you a broad overview. So I'll be looking at the muscles on the outside and the ones on the inside. And we'll talk about it. We'll talk about what feels tight to me, and if there's trigger points that I feel, and how we can work on them, what you can do together with me, what you can do at home, because everything happens at home. If I give you homework and you don't do it, you're not going to see results. And then we would also talk about how to control those muscles and how to kind of make them functional, because functional muscles are able to contract and then relax back into their position. So if they're not doing that and they have trigger points, then we're going to talk about that. We're going to go over your diet. We're going to go over how much water you're drinking. And then I'll do some treatment. So my treatment can be anything from doing trigger point release, which is kind of like a massage, and if you've ever had trigger points in any other part of your body, sometimes it feels like a deep massage. And we would also do dilator work. So the dilators that I have here. So I start out with women, obviously with vaginismus, who, okay, so I'm getting some questions. So start out with dilators that start just as small as this. This is like my favorite brand, Intimate Rose, made by a pelvic floor PT. They are silicone, I believe, so you're not going to use these with silicone lubricants. This is the smallest one, and they range, so there's a few sizes in between these, and these are the largest ones. So obviously, if your partner is not this big, if you're not anticipating having a partner this big, we wouldn't go up to this size. But if you want to have sex, we also wouldn't start at this size. Other homework and things. So your homework would obviously start out with these on your own. But if you're planning on having sex with a partner, then you're going to bring your partner in, either with me or in the bedroom, and you're going to work on these things. So it may just be you putting it in and letting them be there. It may just be having them touch you. Leave it there, and then eventually like move a little bit in and not move at all. But one of the things that I really tell women is that you have to be comfortable giving yourself to another person. And you have to be comfortable with them having power over your body, because when you're being penetrated with a penis, you don't really have much control unless you're on top. That's another thing we'll talk about, is positions and what positions are best for you, especially when you're having some of this pain and trigger points. It could be in a position that, it could be in a muscle that is being hit when you're in a certain position. So we would have to talk about your positions. And then you can also have homework with one of these, which are my wands. Again, made by the same company. They're, I believe, hypoallergenic. This one vibrates. This one does not. And I have links to these on my website. It's privatepractice.com, and there's discounts on there. So these you would use by holding this way, and then you'd insert it, and this would be pretty much my fingers, how I would do the massage on you in the office, or I would tell you to trigger point in the office, you would do it with this. And then for men, because you have pelvic floors as well, if you have trigger points, which could lead to a range of different issues, but if you have questions and you're a brave soldier, please DM me and we'll talk about it. You can use this anally. Again, women have dysfunctions as well that cause them to have to use it anally as well. Again, this one vibrates, this one does not. And then my O-nut, this is the love of my life. I suggest this to all of my patients, some with endometriosis, some with dyspeunia, some with vaginismus. This is the O-nut, and you put it over the penetrating partner, you lube it up, and it feels just like a vagina for the men. And then it acts as a buffer. So I can actually put it over one now. You put it on the penetrating partner, and it acts as a buffer so that they can only go in as far as you allow them to, or as far as the O-nut allows them to. And so this helps with dyspeunia because it allows you to say, hey, I don't like you going that deep. That doesn't really feel well to me. I'm not ready for that. So it allows you to still have the organic experience of having sex, and you can still, have some protection. And then what happens is it's 4 pieces. So you can take one off and they graduate, and then you can still have sex. Yeah. So let me look and see if there's any questions. Yeah. Oh, you wrote it down. Thank you. Okay, so what are the recommended vaginal soaps for women? So there's a lot of companies that are making new things. Women, again, I tell you, please look at your sanitary napkins. Please look at your soaps. So Dove, please do not use Dove on your vagina. Please, just don't. Just don't do it. It drives me insane. Please don't use Dove. Honest Co., I really love their brand. They have a vaginal wash that is amazing. I think they do have one that has scents, so I'll give them a pass on that. But Honest Co. is the one that I really vouch for. Who else? Honestly, I believe you just have to look at the... hold on here, I'm getting elaborate. I don't have any idea what those things are. You talking about this? Who is that? Is that... I think she was talking about the wand. About the wand? Okay, so I can go back to that. But as far as soaps, so just read the ingredients. If it's a whole bunch of stuff that you really don't know about and you can't Google and understand the language, don't use it on your vagina. Just don't do it. It's not okay. Dr. Bronner's, yes, I like Dr. Bronner's just because that is, what's the base of that soap? It's, Castile. Yeah, that is a really good soap. I like that one too. I would just say, I know it comes in peppermint and all that stuff. So if you know that you've been exposed with peppermint before and it didn't harm you, it didn't make you feel some type of way, go for it. But otherwise they have the bland ones that smell like nothing, use those. Let's see, other questions. Can every woman squirt? I don't want to say yes. I think that it definitely comes with self-exploration. It definitely comes with comfort. If you and your partner are comfortable, if you by yourself are comfortable, the female ejaculation feels like pushing it, feels like you have to urinate. And most women stop at that point. So they're saying that I feel like I'm going to pee on myself. I don't go that far. They stop right before it, and a lot of women aren't having orgasms. So I would say explore that realm by yourself. Try it by yourself. Put down a tarp or whatever you have to do, a towel, and try it. See if you can squirt. Don't go crazy because you also don't want to give yourself a UTI from masturbating too much. But I wouldn't say that every woman can do it. It's just about comfort level and kind of just pushing past the limits of what the norms are. Let's see. What do you recommend for bad cramps, for really bad cramps? Yoni steams. I am an advocate for yoni steams, but only when you know the person. Get an herbalist. Do not just go to some random person who's making pearls and all kinds of things for your vagina. Don't do that. All the things on Instagram, really look at your sources. and you want to find out what kind of herbs are going to help with the symptoms that you're having. Because you may be having bad cramps, but you may be having other things that are going on with your vagina. So an herbalist is going to be able to tell you what kind of herbs should be in that yoni steam, and then they're also going to tell you when to do those yoni steams. So you don't want to be doing them too close to your period, or when you're actually on your period. Let's see. And so essentially what a yoni steam does is kind of just like a hot pack for your vaginal muscles, your pelvic floor muscles. So just like how if you're having cramps, you put that the hot pack on your back, and it kind of like relieves some of like your back pain, things like that. When you're doing a yoni steam, it's helping those muscles relax so that they can loosen, and that when they're expelling and they're tightening up, it's not as bad for you. Okay. Elaborate on the diagnoses that I mentioned earlier. Okay, so let's talk about them. The two of them are vaginismus. Vaginismus is going to be the spasms, and those, where's my pelvis? That's the spasms of these muscles here. So right around here on the outside. It's pretty much like a loop, so it goes here around. And those muscles, they pretty much spasm. You can have spasms if you've never been penetrated, and that can be just like walking down the street, you might feel like it just feels a little off. Or it could be that you've had sex before and it was painful, and now you're just in that loop. So these are functional muscles, right? So they also are active when you're breathing. So when you breathe in and you breathe deep, they're releasing a little bit. It's very slight, but they're releasing a little bit. And then when you exhale, they tighten just a little bit. So if you think about if you're freaking out about sex, or if you know it was painful last time and you freak out about this time and you're breathing fast, that's causing the muscles to kind of contract and relax very fast with your breath, and then it's going to lead to spasm. And then you won't be able to have sex at all. So essentially what I'm doing with all of the home exercise programs and these tools is teaching you that when you're being penetrated, it doesn't hurt, or it won't hurt, and you can kind of lubricate yourself, you can lubricate the items that you're using so that it'll be easier. And then dyspeunia is pain with intercourse. It's just a general term, but they also split it into superficial or deep. And so superficial is, again, the muscles that are superficial here. So this is layer 1 is what you're seeing without these on the outside, because these are the same muscles. This right here, those are the same muscles that are on the inside here. And so deep dyspeunia is going to be here on the inside. And so essentially what that means is that there's just pain with intercourse, and it can be from different things. It could be from endometriosis, which, you know, might leave behind some scar tissue that doesn't feel nice, doesn't lubricate well, doesn't do well with kind of poking the bear. Or it can be from tight muscles. It can be from muscle spasms. It could be, not muscle spasms, I'm sorry, muscle trigger points, and then again, it's poking the bear. So think about working out. If you're working out your bicep all day, and because you're working out your pelvic floor all day, it's holding up your organs. So say you worked out your bicep all day, you put down that weight, you don't stretch, because how are you stretching your pelvic floor if you've never knew about it? And then you go to have sex, or someone comes by you and they tap you on your bicep. You are not going to be a happy person. So that's exactly what's happening with your pelvic floor. Okay. Let me know if I answered that, if you have more questions about it. And before your cycle, will having sex lessen your cramps? So it depends. If you are having sex to completion and you are orgasming, then that's going to be like a release for your muscles. So what happens during orgasm is that it's involuntary. You completely contract. A lot of times other muscles in your body contract, and then you release. So before your cycle, if you're having sex and you're actually releasing, then it might be helpful for your period. I know women who have sex on their period and it actually lessens their cramps. Again, if you're orgasming, it might be that. But that's not for everybody. and then a certain position that helps your chances of squirting. So it's going to be the G-spot. So your G-spot is located, I obviously can't stick my finger through here. That's not an actual hole that my finger sticks through. So it's going to be in this area up here. So imagine if you're putting your finger or penetrating here and you're making that come hither motion. That's going to give you the best chance of squirting. I have another question. I can't read it. I believe a lot of females don't know. So yeah, 7:30. Guys, feel free to DM me any questions. Again, this is a safe space. I'm just really trying to create a safe space for men and women. Men, if you have any questions, feel free to DM me as well. Let's keep it cute. And anything else? Oh, so again, check out the events. There's a couples event coming up, but I will be doing pelvic floor play for individuals again. Couples can be anything, LGBTQ and all the rest of the letters. You are included. So please take a look. The link is in the bio. Thank you guys for tuning in.